The brain consists of two cerebral hemispheres, two cerebellar hemispheres, and brain stem. The brain stem consists of the medulla oblongata, pons, and midbrain from below upwards. The medulla oblongata extends from the lower border of the foramen magnum to the lower border of the pons. It is bulb-like, and hence lesions in the medulla leads to bulbar paralysis, and the pyramidal fibers ending in the brain stem are called corticobulbar fibers. This is a sagittal section in the brain stem to show the parts of the medulla oblongata. The medulla oblongata is divided into two parts called open medulla and closed medulla. The open medulla is the upper part and fourth ventricle behind it, while the closed medulla is the lower part and has a central canal inside it. By open medulla is meant that its posterior part is open to form the fourth ventricle. This is the anterior surface of the medulla. It shows the anterior median fissure in the midline. On each side of this fissure lies a pyramidal elevation called the pyramid. This pyramid contains the pyramidal or corticospinal fibers, which are the upper motor neuron fibers. Lateral to the pyramid lies the olive, which is an olive-like swelling produced by a big nucleus called the olivary nucleus, which is a part of the extrapyramidal system. The groove between the pyramid and olive shows the fine rootlets of the hypoglossal nerve. The hypoglossal nerve is the 12th cranial nerve and supplies the muscles of the tongue. Notice the close relation of the hypoglossal nerve to the pyramid, because if a lesion occurs here, both structures are vulnerable to the damage. This condition is called alternating hypoglossal hemiplegia. Lateral to the olive lies a longer elevation passing from the middle of the side of the medulla to the cerebellum. And is called the inferior cerebellar peduncle. It carries mainly, but not wholly, fibers from the spinal cord and medulla oblongata to the cerebellum. The groove between the olive and the inferior cerebellar peduncle shows the rootlets of the glossopharyngeal, vagus, and accessory nerves as arranged from above downwards. The glossopharyngeal is the 9th cranial, the vagus is the 10th cranial, while the accessory is the 11th cranial. At the junction between the medulla and the pons, notice the attachment of the abducent or sixth cranial nerve at the base of the pyramid. Notice also the attachments of the facial, which is the seventh cranial, and the auditory, which is the eighth cranial. Both lie on the side in line with the ninth, 10th, and 11th nerves at an angle called cerebello-pontine angle. At this angle, notice the presence of the lateral termination of the choroid plexus and the lateral aperture of the fourth ventricle. A tumor of this angle will compress the seventh and eighth nerves as well as the neighboring cerebellum. Notice that each of the cranial nerves as a whole has a deep origin from a nucleus or more inside the brain stem and leaves the brain surface at its superficial attachment. The olfactory and optic nerves, which are the first and second cranial, are attached to the cerebral hemispheres directly. This is the posterior surface of the medulla oblongata. Its lower half shows the gracile and cuneate fasciculi as longitudinal bands on each side of the posterior median sulcus. The gracile fasciculus or tract is the medial, while the cuneate fasciculus is the lateral. These two fasciculi end above in the gracile and cuneate tubercles. This is the gracile tubercle, and this is the cuneate tubercle, which are produced by the gracile and cuneate nuclei. The upper half of this surface of the medulla enters into the formation of the fourth ventricle as it belongs to the open medulla.